University of California, San Francisco is meeting on antepartum and interpartum management. Dr. Meg Autry served as a mythbuster, talking about the myths that patients have about prenatal care.
It depends. Some of the questions are that I want to bring up, and a lot of questions that come up in the office are because the patient brings them up. So really in terms of diet, I want to stress that having a well-balanced diet and eating and taking standard prenatal vitamins is probably all that you need to do. You don't, in addition, need additional supplementation. Specifically, the literature looks at omega-3 supplementation, vitamin D, calcium. If you have a well-balanced diet and you're taking your prenatal vitamins, you probably don't need more than that.
Okay. And what about fish? Is fish and mercury a problem?
So one of the big topics of my talk was talking about the advantages of fish, both for cardiovascular health for the mom as well as neurodevelopmental health for the baby. And really the advantages of eating fish are that they're high in omega-3s. The thing that people worry about is methylmercury. And so there's now been a lot of data out that shows that fish consumption of fish that are low in mercury but high in omega-3s, which we have a lot in this country, particularly salmon, shrimp, catfish, are good to eat, and that actually supplementing with omega-3s has not been shown to be helpful. So actually eating a healthy diet, at least 2 meals a day of fish that are low in mercury but high in omega-3s is actually very beneficial.
These days we're a big caffeine country. How's that for pregnancy?
So about 85% of women ingest some sort of caffeine, either in their food or beverage, daily. The literature based on the bad effects of caffeine are mostly related, is old and are mostly confounded by cigarette data. So I would tell people that if they drink low to moderate amounts of caffeine, that it's probably okay.
Are there things to avoid? Alcohol, cigarettes, anything else?
Yeah, I would say alcohol and cigarettes are big. There is no known proof safe level of either. I would say in terms of nicotine, that one of the things that we don't realize is that it's really underreported, and although a lot of women quit for their pregnancy, about 90% of them start back after the pregnancy. And so it's really important to think and continue smoking cessation throughout the pregnancy, because in addition, keeping smoke out of the home is very important for the baby in terms of prevention of SIDS as well as asthma.
Well, even pregnant women want to look good and feel good. What about hair dyes, mani-pedis?
So as far as we know, I mean, mani-pedis and hair dye are safe. There's no literature to say that it's detrimental in pregnancy, and I would in fact encourage it so people feel good. I think you have to look at what you're using, look at the places that you're going, but I think it's fine.